Hello friends, today we are going to study about the chapter of exercise therapy, that is Introduction to Exercise Therapy. So let's start. So, if we talk about the introduction to the exercise therapy, then we can say that why the exercise is important, how it plays a role in our lives, right? So, if we see exercise therapy is the therapy or the treatment which we do with the help of exercises, right? In this we do not take any medicines or anything means, but we are prescribing the exercises or making the patient do the exercise by which his or her ailments gets corrected, right? So that is the exercise therapy, means treatment with the exercises, right? So if we talk about the exercise therapy, what does it help with? See, exercise therapy helps us to increase our recovery, right? It helps to accelerate our recovery. It speeds up our recovery. If we are suffering from the injuries or any ailments, then it helps to speed up the recovery, right? For example, if the patient is injured, for example, the patient's leg is injured and he is walking with the limp, right? So for the time being he is walking with the limp, that is okay, because for doing the activities or for solving his purpose of activities, he needs to do that, right? But if he continues with that, is it fine? No. Why? Because it is not the normal pattern, right? Which he is now following after the recovery also, right? So there is a abnormal thing because he is limping. Because it is not normal. Anything which deviates from the normal, that is abnormal, right? So it will place some it will place the problems or the structures of the muscles get tightened. If they are not in the normal pattern, it further causes the problem. So exercise therapy helps us to speed up our recovery, right? The demands which are placed by our environment, for example, we are doing our day to day activities and we are doing our activities which required in the daily livings, right? For example, you are doing your bathing, your brushing of teeth and toileting. Anything means which is required in your job or you're doing in your daily life, right? If it is hampered due to any injury, or it is not getting in the proper way in due to injury, then it is abnormal, right? And what does the exercise therapy do? It speeds up our recovery. For example, if you are getting any injury and if you do the exercise along with it, then it helps to correct your injury in the correct way, right? In the correct pattern. And it will also helps you to increase your recovery, means it will help you to get rid of your problem very fastly, right? So if we talk about, see, your exercise therapy, now you know what is exercise therapy, right? See, exercise therapy is what? It is a treatment with exercise, right? And what it helps? It helps to fasten your recovery, right? Means if you get any injury, then it helps to fasten your recovery and correct your injury in the correct pattern, right? Let us take one example. See, for example, patient has got the injury uh, in his leg, right? For example, he got injured from here, right? Or any ligament in the ankle, for example, you can take it, right? And if he's suffering from the injury, then obviously he'll walk with the limp, right? But if you see, this limp is not a normal thing. It's not normal. right? Means he is doing his activity for doing his activity, or for completing the demands which are placed upon him or her by the environment. He is doing this, right? He is taking the you, or he assumes some pattern by which he can fulfill the demands, right? So right now he is limping or she is limping, but it's okay, it's or that's okay for the temporary, or that's okay for the temporary basis, but not okay for all the lifetime, right? Because if he will or she will walk like that only, then it will create or it will create the problem in the structures, the normal structures, right? And he is not walking in the normal pattern, so his or her biomechanics will be altered, and he is suffering problems due to it in all the parts of the body, right? So, I mean to say that if you get any injury, then exercise therapy is a means of accelerating your recovery, and it helps to get rid from that injury, right? Okay. And if I take one more example to make you understand, see, if you got the ankle sprain, right? The swelling is very much, right there. It will get resolved. Swelling will get resolved. But if you do not do the exercise, or you will not strengthen the particular muscles which are involved, then what happens is you will not assume the correct walking pattern. If you do not assume the correct walking pattern, and you are again, when you recovered, you again walk in that incorrect pattern which you assumed, or alternating pattern which you assume when you were injured, then it will create a lot of problems in your biomechanics, which will alter the another structures, right? If another structures will be altered, you will got the problem in that area also, but along with that you will also get the problem in your other body parts. For example, if you see the biomechanics, if it is altered, or the structures are are not in the correct pattern in the ankle, it will deform the biomechanics in all the body, right? You know that if it happens, now you can see there is not the problem in one region, but it can take the problem in all parts of the body, right? So it is very important, very very important to to recover or to get rid of the injury in the correct pattern, and you should strengthen your muscles so that your biomechanics would not be interrupted, and you can recover in a nice way, right? And it is very important to get recovered in a correct way, until or unless until or unless it can't, it is impossible. For example, let us take the example that the patient for example, the patient B has got the injury, right? Got the injury. What type of injury? The patient becomes amputated, right? Now he is limping, or assume any or assume any alternating pattern, right? Let me take a new slide. See, if the patient got injury and got amputated, right? Here what happens is he'll assume some pattern or alternating pattern, right? Why he is assuming this pattern? You know that now. To fulfill the demands of the environment, right? But what happens is the pattern which he assumes, right? The pattern which he assumes. Now it's not possible to come in the pattern which he has before the injury, because the leg is amputated, right? Now it's not possible to assume the prior posture, or to assume the prior position. You know why? Because the leg is amputated and there is no more leg. So what we do with the help of exercises, we make the muscle strengthen which are available and help to give the patient possible, nearly possible his earlier, his earlier life. How? By giving him the prosthesis or by making the patient do the exercises so that it, with the help of prosthesis, he can nearly fit to his previous environment, right? So now the importance of exercise therapy. It is very important to what, to gain the normal pattern after the injury and to speeden up the recovery. And if it is not possible to regain the earlier position or earlier pattern, we do some exercises to make the patient nearly, to make the patient come in the prior position very close to, right? Means by using the processes, we make some exercises or make the changes in the environment so that patient can assume his the previous life. Means as how much it is possible, right? So exercise therapy does that. Okay, so now let's see the aims of exercise therapy. See, we have many aims of the exercise therapy. Let us see. To promote the activity whenever and wherever possible to minimize the effects of inactivity. What do you mean by that? Means exercise therapy promotes or it helps the in the activity that wherever the active activity is not possible by the patient, or the activity wherever it is not possible by the patient, exercise therapy promotes that it to allow that activity so that it helps to minimize the effects of inactivity. What is the meaning of inactivity? Means no activity. Let us take the example to make you understand. See, for example, if the patient is hospitalized, right, he or she is not able to move, right, in the ICU, he or she is not able to move. So what the therapist do, he do the passive movements there to maintain the circulation and the range of joint of movement so that the joint range of motion is not hampered, right? If the activity is not there in the joint for for a period of time, then it will become stiff, right? Once it becomes stiff, for then also if the inactivity is there, the structures become tightened and their contractures will be formed. Means it will lead to the complications if you are not performing the activity there. So wherever the activity is not possible or wherever it is not allowed, allowed means we can say wherever it is not happening, wherever the exercises are not happening or the active movement is not happening, exercise therapy allows there. Okay, for example, we have taken the example of the hospitalized patient in the ICUs, or you can take the example of the stroke patient. Half of the side is paralyzed, so patient is not feeling that half of the side, so he or she will not be able to move that. So what the therapist does, the role of the therapist is to maintain the joint range of motion until or unless the patient is not able to perform that activity, so that it won't lead to that complications further, right? It will help you not only gain the range of motion, it will also help you to break that, means not developing the adhesions and contractures, and also it will allow you to maintain the circulation of the body. Now let me take one more example. For example, again in the hospitalized patient, patient is immobilized because he is unconscious or is not able to perform the movement. So what the therapist is instructing his attendants, or what he does himself, is he is doing the passive movements, ankle toe movements, passive ankle toe movements. Why? If the ankle toe movements are not happening or not performing by the patient himself, then the therapist does that, or the passive, or it is done by any of the attendant, right? It is very important because it will allow the patient's circulation properly until or unless it is immobilized, right? So it is very important. So exercise therapy promote the activity whenever and wherever possible to minimize the effects of inactivity. Means where the inactivity is there, where there is no movement, so it can be bring the movement passively so that it won't lead to further complications, right? It can lead to DVT if there is no ankle toe pump movement, right? So it promotes that. Second aim, if we see that, to correct the inefficiency of the specific muscle or muscle group and regain the normal joint range of motion without delay to achieve the efficient functional movement. Again, means when the movement of the pattern is not correct, right? So it is helping to correct the inefficiency of the muscle. For example, if I say your deltoid is weak, right? Your deltoid is weak, so you are unable to take your hand the to fully abduction, right? You are unable to take your hand to fully abduction due to the you can say due to the injury, also due to the inefficiency or insufficiency of the muscle of like deltoid, right? So what the exercise therapy do, it helps to correct that injury. It helps to correct that problem so that you yourself are allowed to do that activity, right? It strengthens some group of muscles so that it will allow you to do that activity, right? If it is not the muscle, then it will help you to gain that strength, right? It will help you to gain that strength, because it is very important. If your muscle is weak, or your you are having some problem, by that you are not able to move your limb or do perform the activity by of that muscle, then exercise therapy allows you to do that by assessing your problem, then working on it in the specific in the specific area, so that you can get rid of your problem, right? So here what you see, it correct the inefficiency of the specific muscle, right? Like I have told you that, for example, if a deltoid insufficiency is there, then you are unable to move your arm to the abduction, right? So exercise therapy helps you to strengthen your deltoid so that you can take your arm easily up into the abducted position, okay? Or you can raise your arm easily, right? Or if there is any injury, it will help you to with the help of exercise therapy and electrotherapy, it will help you to gain that movement, right? By correcting the all the abnormal things or abnormal patterns, it will allow you to come into the normal pattern. So it will improve the inefficiency of the specific muscles and muscle group, so that you can gain the joint range of motion without delay to achieve efficient functional movement. Means it will not cause the delay. Otherwise, if you don't move your limb, for example, in the case of the frozen shoulder, if I say the patient is unable to move his or her arm due to the pain, due to the pain, because impingement of the structures are happening there. So what the exercise therapy does with the some techniques, it will help you to get rid of that problem by strengthening the muscle around the by strengthening the muscles of the shoulder joint, right? Means around the shoulder, the muscles which are involved, it will strengthen that muscles, right? So that you can take your arm easily up, right? Which is preventing your joint range of motion. If you are not doing any joint range of motion, or due to the pain you are not moving your limb, right? Then it will be it will be remain in that position, and due to the fear of pain you are not taking it up with due to the pain. And what happens is the adhesions are going to start forming in surrounding the muscles. So once the adhesions form, then also you are not doing, there form the contracture, so means complications are leading. So it will not, exercise therapy helps you without any delay solving your problem and gaining your joint range of motion, right? And if we talk about the next point of the aims of physical therapy, or aims of the exercise therapy, that is to encourage the patient to use the ability he has regained in the performance of normal functional activities, so accelerate in rehabilitation. Here what does it means? Let us take the example of frozen shoulder only. See, once the patient is relieved from his pain due to the electrotherapy and exercise therapies, right? Like the therapist is performing some techniques to get rid of the pain, like for example mobilization in case of shoulder joint, right? So that patient is relieved from the pain, and using the ice packs and that hot packs to get rid of the pain, and also the machines, so that if the patient is getting of the relief of the pain, and with the help of exercise the muscle is strengthened somewhat, right? So for example, if the patient is earlier performing the activity only to 80 degrees of abduction, right? So once he has gained some strength even of 20-degree, then exercise therapy helps to encourage the patient, it helps to motivate the patient that you are getting some result with it, and if you do continue in that direction, you will gain more strength, and you are able to perform your function fully without any inactivity, and you are able to go in your earlier life easily if you do the activity. So it helps to encourage the patient that the ability which you have gained, you can continue in that direction. If you do that right, then it will increase your performance of activity, it will enhance your movement, it will make you productive, right? Then you can lead your life very easily. Okay, so it will accelerate in the rehabilitation, right? It will accelerate in the rehabilitation. You can also take one more example. For example, if you are seeing the patient in the hospital setup, right? And once the patient is getting consciousness, but he is not able to do the activity, like for example ankle toe pump only. Once you do the passive movement, right, and slowly patient is getting, even though patient is getting a little movement, then you the therapist, along with the exercise, along with the result which he has gained through the exercise therapy, a little movement, right, that is the result. So it will motivate him along with the therapist will also encourage him, right, and the exercise therapy will also encourage him or motivate him to do the more activities, that the movement which he has gained, he use that movement to bring more movement, so that he or she can return to his normal life. It will speed up his rehabilitation process. Okay, so now we will study about the techniques of exercise therapy. Means what techniques the therapist is using for making the implement of the exercise, right? So these are the techniques of exercise therapy, right? So if we see, first is your active movement, another one is your passive movement, right? In the exercise, either it is passively done or it is actively done, right? And if we see under the active movement, we have the voluntary, means which are done but with your will, and involuntary, which are under patients, no, which are not under the patient's will, right? And if we talk in the voluntary section, what are the components? First is your assisted exercises, another one is your free exercises, then your assisted resisted, and then your resisted, right? And if we take in the involuntary part, then we have the reflex activities. In the passive movement, we have the relaxed passive movements, including your accessory movements. Right, let me take one slide. And your relax passive manual mobilization techniques. So let's discuss one by one. If you see here, we have the techniques of exercise therapy, right? And I have told you that we have either the active movements or the passive movements. Now what do you mean by active movements, or what do you understand by active movements? See, active movements are nothing but they are performed by the patient himself or herself, right? Active means in which you are involved. The means the subject which is performing exercises, he or she is involved, or the muscle is contracting, right? That is the active movement. So in the active movements, for example, the patient is taking his arm up, or taking it outside, or doing any activity by himself or herself, right? The patient doing any activity by himself or herself are included under the active movements, right? Or where the muscle contraction is involved, right? So I write here, active movements are what? These are performed by patient and where the muscle contraction is involved, right? Means if you move your arm, your muscle would be contracted, then only you can move your arm, right? Means if you are taking your shoulder up, right, then your interior fibers of deltoid along with the biceps are taking place, then only you can take your arm upside. So active movements are those movements, the movements which require the patient's activity, and himself or herself by that patient is doing along with the muscle contraction involved, right? So these are the active movements. In the active movements, we have the two types, that is your voluntary and your involuntary. Voluntary means if the patient is performing the movement with his or her will, right? But the involuntary is not under the patient's control, right? Involuntary is not under the patient's control. If we see in the voluntary section, we have the assisted exercises, free exercises, assisted, resisted, and resisted exercises. So what do you mean by these terms? Let us see one by one. It's not difficult. You will just understand it, then it is very easy for you. See, if we see the assisted exercises, what do you mean by that? Assisted exercises means, for example, if we see the patient's muscle power is not that much that he can or she can move his arm up or taking it in the flexion position by himself or herself, right? Let me take one slide to make you understand. See, for example, this is one patient, right? And he is flexing his arm, right? He is flexing his arm, and the therapist, for example, this is the therapist, right? And this is the patient. Therapist instruct the patient to take his arm to 180 degree, right? Means, uh, for example, just a minute. See, for example, see, therapist instructed the patient to take his arm to 180 degree. So therapist gives the instruction to patient to take or to lift his arm to 180 degree, right? But patient can only take his arm to 90 degree. Listen it carefully. Therapist instructed the patient to take or lift his arm to 180 degree, means to fully, right? But the patient himself can do only to 90 degree because of the muscle weakness. Patient is unable to move his arm to fully 180 degree, right? So what is the line of treatment is, if the patient is unable to do, the therapist will aid him or help him, right, to lift his arm to full range of motion. So here is the same thing. When the patient is taking his arm to 90 degree only, then what the therapist do? Therapist will aid him or give him the support, right? Give him the support to lift his arm. So the support which is given by the therapist to lift the patient arm from 90 degree to 180 degree, right? The support which is given by the therapist to lift the patient's arm from 90 degree to 180 degree, that these exercises, the exercises or the movement which is happening is called your assisted exercises, right? So these are called your assisted exercises. Assisted means to support or to give help, right? To give support or to give help. So the therapist is assisting the patient to lift his arm from 90 degree to 180 degree. So the movement which is given or which is done with the support, right, or with the help, these movement or these exercises which are called your assisted exercises, right? So the line of treatment would be that only, if the patient is unable to perform or has a little power in his muscle or her muscle, then therapist will aid him to increase in that power, right? So he or she will aid him, therapist will aid him to regain the full range of motion, right? So these exercises or the movements which involve the support, that movements or that exercises are called your assisted exercises, right? And then if we move to the next thing, then you have the free exercises. So if you see, let me take another slide. So if you see, once the therapist is performing the movement, or you can also take the example in the frozen shoulder only, means patient is unable to move his arm due to the pain above the 90 degree, then therapist will help him to take it. It will take some time. Then once the range of motion is gained, right? Once the range of motion is gained, either he is unable to do due to the muscle power, means that muscle strength, or the due to the pain or any reason, right? Once the range of motion is achieved, then patient can do himself in full range of motion. So after the assistance, when therapist is providing the assistance and taking the patient to regain his full range of motion, then he is free to do in the full range of motion exercises, right? Then the therapist, what the therapist function is, therapist will prescribe him or give him the exercises in the full range of motion. But it's very important, but that do not involve any assistance, right? Means assistance is not required now. Why? Because the range of motion is now, patient can do the in the full range of motion, right? Movement is gained with the help. So with the assisted exercises, the movement is gained. Now now the therapist will give him the set of exercises which the patient himself can do, right? So the exercises which are performed by the patient himself without any assistance, right? Without any assistance, that exercises are called free exercises, right? For example, what? Lifting the arm, right? Or any other example, taking the arm to the side. Or also therapist can prescribe some functional exercises. What are the functional exercises? Means the activities which are required the movement. So the therapist has given the exercises in the activity only, right? So these are called the functional exercises. Means any exercises or any movement now which the patient can perform without the assistance of therapist or without any other assistance, right? Then these exercises or these movements are coming under the category of free exercises, right? Now if we discuss the another part, that is your assisted exercises. If you see, we are also planning the treatment in these series only. Means first you give the assistance to the patient. Now if the patient is not needing any assistance, then you provide him the free exercises. Once he is once he has or once he has the able to, or once the patient is able to do the free exercises, means he is now independently doing these exercises, then you can put him to the assisted resisted exercises. Assisted resisted exercises means what are they? Let us take the example. Wait, see, now if I talk about the assisted resisted exercises, see, now patient can do the exercises in the free range, right? Or free exercises means patient is able to perform, patient is now able to perform in full range of motion. But to increase the strength, but to increase the strength of the muscle or power of the muscle, right? Increase the strength or power of the muscle, you provide the weights or resistance, right? So here for example, now patient is able to perform or lift his arm to 180 degree, right? From 0 to 180 degree, now patient can perform his movement independently. But what you have to do is, you have to increase the strength of the patient. You have to increase the strength of the muscles which are involved in lifting the arm. Now what you do is, either you provide the resistance with the help of physiotherapist's hand, or you can provide, means the resistance means resistance means you are not allowing the movement, but patient has to overcome it. So how he will overcome it? He will overcome it only if he has the strength in the muscle, right? So for increasing the strength or power of the muscle, you are providing the resistance externally, right, to the patient, either in the form of therapist's hand or in the form of weights or springs, means anything, the resistance which you are providing externally to hamper the movement, or so that patient can overcome it, right? So here, if the patient is able to perform the independently movement without any resistance in the full range of motion, now what the next step is? Assisted resisted exercises means you provide the resistance to the patient. Now resistance can be provided either in the form of therapist's hand. For example, here if I ask you to lift your arm, right, to 180 degree, what I do is I provide the resistance with my hand to the distal to your distal joint, right, or to the proximal joint or to the distal joint, so that I'll make the resistance in the opposite direction so that you are not able to perform that movement, right? So this is the resistance. Or for example, I put some weight, right, ankle weight in your arm, and for example I put the half kgs weight on your arm, and now to overcome the half kg weight by lifting the arm, or in order to lift that half kg weight, the power should be there in the muscle, right? But it is not maintained in the muscle. So how we will maintain it? By providing the resistance. Along with that, the therapist provide the assistance, means patient is taking or lifting his arm, but at the 90-degree, if he stops, or if he is unable to take his arm or lift his arm to the next level, then therapist will provide the assistance so that he or she can take his or lift his arm to the full range of motion. Okay, so assisted means you are providing the resistance. Along with that, if the patient is unable to perform that movement in the full range of movement, you provide the assistance, right? So these movements which you are taking in or the movements which in which the resistance is provided, but if you are not able to do, then assistance is provided along with it. These movements or these exercises are called assisted resisted exercises. Okay, so now let's talk about the next, that is your resisted exercises. So what happens in resisted exercises? See, uh, let me take the slide. Okay, now if we talk about the resisted exercises, now once the patient is able to perform with the resistance and you are providing the assistance, now if patient has gained some strength, right, and you slowly and slowly, or the therapist slowly and slowly taking out the assistance, means the assistance which is provided by the therapist, now slowly and slowly he is not giving the assistance or he is removing that assistant, and then you perform the exercises with the help of or with the along with the resistance, then these movements or these exercises, that are called your resisted exercises, right? Means the patient performing the movement in the full range along with the resistance. And you know that resistance could be anything, right? This resistance could be therapist hand, this resistance could be your ankle weights, this resistance could be your therabands, this resistance could be your dumbbells or your springs, anything means which is providing the resistance to the movement. Then with that resistance, if the patient is overcoming this resistance and performing the movement in the full range, then these type of exercises are called your resisted exercises, right? So if we see are the active movement in the, and the section of the voluntary exercises, we have discussed all the parts, that is your assisted exercises, your free exercises, your resisted and your resisted exercises. And one more thing, if I tell you, if you are taking or seeing the patient, you follow the same pattern, right? Means from assisted to resisted exercises, you have follow the pattern, you have to follow the pattern, right? And if I see in the active movement involuntary, for example, if I see the manipulation, right? Manipulation, if the therapist is performing, it is not under the control of the patient, so this movement is your reflexive movement. Or you can say if you touch the hot object, right, suddenly your hand withdraws, so that moment you did not decide, but it is the reflex. Or you can if you place the hammer on the knee tendon, right, suddenly your knee happens, what happens to your knee? It will come in the extension position, but you don't know or you don't plan it to move it into the extension position. That is your reflex activity, that comes under your involuntary section. Why? Because you are not wishing of doing that movement, that happens out of your control, right? So these are the involuntary movements. Now let's discuss the passive movements. So the second technique is your passive movement. we have discussed in the aims also, wherever the activity is not possible by the patient, we perform the activity there, right? So that activity is called your passive movement. What is passive? Passive means where the patient is not involved. Patient himself or herself is not involved in doing the exercises, right? He or she is are not able to do performing the exercises, or in not a condition to do the exercises. There the therapist is performing the exercises. So the exercises which are performing by the therapist and not involving the patient, so that exercises are called your passive movements, right? Or the movements that are called your passive movements. In that also we have the subtypes. We have the relaxed passive movements, including the accessory movements, and also we have the passive manual mobilizations, right? If we see relaxed passive movements, we do in the hospital settings where the patient is in ICU, right? He or she is immobilized because he or she is not conscious and they are not doing any movement. But it is very important to do the movement in the ICU for the circulation also, and also to prevent the complications like your pressure sores, your adhesions, your contractures, right? So to get rid of these complications, the therapist performs the movement on the patient, right? Means the therapist performs the movement of flexion and extension of the shoulder, abduction and adduction of the shoulder, like also in the lower limb, right? And changing the positions. So here the effort of the patient is not involved. So where the patient's effort is not involved and only the movement is done by the external effort or the therapist, that movements are called your passive movements. So these comes under your relaxed passive movements, right? And if we will talk about the mobilizations also. If we see, right, see here, just a second. So if we see, the second part of the passive movement is your relaxed passive movements. Here if you see, we perform some mobilization techniques to get rid of the pain and also to increase the range of motion. We will discuss it in detail in the another video, but for now you just have to remember that the mobilization techniques are performed by the therapist, and here no involvement of the patient is there, right? So these are the techniques which are performed by the therapist to increase the range of motion, to increase the range of motion, and also to alleviate the pain, means to decrease the pain, right? So these are the techniques which are performed to increase the range of motion and to decrease the pain. So these are the techniques, these are fully done by the patient, sorry, therapist, right? These are fully done by the therapist and there is no involvement of the patient. So these also comes under your passive movement. Okay.